we have in the lung lymphatic circulation as well. Lymphatic are found in all of the supporting tissue of the lungs. Particulate matter entering the alveoli is removed by the way of the lymphatic channels. Plasma proteins leaking from the lungs capillaries are also removed from the lung tissue, helping prevent edema. Okay. Pressure in the lung, in the pulmonary system, in the pulmonary circulation are low compared with those in the systemic circulation. Okay, these very important points. And the pressure in the pulmonary system, pressure in the right ventricles, the source of the pulmonary system circulation is there is in the right ventricle. The pressure pulse curves of the right ventricle and pulmonary artery are shown in the lower portion of the figure you see later. These curves are contrasted with the much higher aortic pressure curve shown in the upper portion of the figure. This systolic pressure in the right ventricles of the normal human averages about 25 ages about to 25 ages about 25 about to 0 to 1 about 0 to 1 about for the left ventricle You can see in this figure pulmonary artery pressure in the normal human being. The average systolic pulmonary arterial pressure is about 25 mm mercury. The diastolic pulmonary arterial pressure is about 8 mm mercury, and the mean pulmonary arterial pressure is about 15 mm mercury. You can see in this figure the pressure pulse in the right ventricle, pulmonary artery, and the aorta. In the aorta pressure, the systolic pressure is high, and the diastolic pressure is high. And in the contrast, in the right ventricle curves, the pressure in the systolic is high, and the diastolic is 0. In the pulmonary artery curves, is compared with the aortic pressure, the systolic pressure is 25 mm mercury, and the diastolic is the 8. Okay, this shows the pulmonary artery curves. Taken together, pressure in the pulmonary system, right ventricle systolic is the 25 mm mercury, diastolic is the 0 to 1 mm mercury. Okay, in this is the pulmonary system. In the pulmonary artery, the systolic you have a 25 mm mercury, diastolic is the 8 mm mercury. Mean pulmonary arterial pressure is 15 mm mercury. The pulmonary vein average is about 5 mm mercury. Pulmonary capillaries is 7 mm mercury. In the left atrium, okay, average pressure is 2 mm mercury. Pressure in the pulmonary arteries, okay, during the systole, the pressure in the pulmonary artery is essentially equal to the pressure in the right ventricle, as also shown in the figure. Okay, you see that the before in the figure. However, after the pulmonary valve closes at the end of the systolic, the ventricle pressure falls precipitously, whereas the pulmonary artery pressure falls more slowly as blood flows through the capillaries of the lungs. As shown in the figure, you can see the systolic pulmonary arterial pressure normally averages about 25 mm mercury in the human being. The diastolic pulmonary artery pressure is about 8 mm mercury, and the mean pulmonary pressure is 15 mm mercury. The pulmonary capillary pressure, the mean pulmonary capillary pressure in the circulation, in the lung circulation, has been estimated through the indirect means to be about 7 mm mercury. Okay, is compared with the systemic circulation. Is low, relatively low. You can see in this figure the left atrial and the pulmonary venous pressures. The main pressure in the left atrium and the major pulmonary veins averages about 2 millimeter mercury in the combined human being. Okay, and you can see the pressure is the difference vessel of the lungs. D means diastolic, M means mean, M shows the means, and S shows the systolic. Red curve is shows the arterial pulsation. You can see the pressure in the systolic is high, 25. The diastolic is low, 8, and the mean is the of 15, and the pulmonary capillary is the pressure is the 7. In the left atrium pressure is the low, is the 2. Okay, you can see the high pressure and the flow from the high pressure to low pressure pathway. We can result from this discussion the right ventricle is the source of the pulmonary circulation. After that right ventricle we see the pulmonary artery. After that the capillaries. This is the point of where the gaseous exchange takes place between the alveoli and the blood, and then the blood enter the pulmonary veins and then the transport to the left atrium. This start points and this the end of the points, the pathway, okay, for the pulmonary circulation. The left atrial pressure can be estimated by measuring the pulmonary wedge pressure. A direct measurement of the left arterial pressure is difficult because it requires passing a catheter retrograde through the left ventricle. The pulmonary wedge pressure can be measured by the floating balloon taped catheter through the right heart and the pulmonary artery until the catheter wedges tightly in the smaller branch of the artery. Because all blood flow has been stopped in the blood vessels extending from the plaqued artery, and almost direct connection is made through the pulmonary capillaries with the blood in the pulmonary veins. The wedge pressure is usually only 2 to 3 millimeter mercury higher than in the left arterial pressure. Wedge pressure measurements are used often for studying changes in the left arterial pressure in person with the various types of the heart failure. The blood volume of the lungs provide important blood reservoir, and the pulmonary blood volume is about 450 milliliter, and or about 90% of the total blood volumes. Under various physiological and pathophysiological conditions, the quantity of the blood in the lungs can vary from as little as 1/2 to 2 times normal. Okay, you can see in this figure the blood flow at different levels of the lung of an upright person and the rest and during the exercise is different. Note that when the person at the rest, the blood flow is very low at the top of the lungs. Most of the flow is through the bottom of the lungs. You can see in this here is top, is the middle lungs level, and this is the bottom. The red curves is standing at the rest, and the blue shows the exercise. Okay, exercise position is situation. Blood flow is the uneven or imbalance with the lungs. The gravity causes blood pressure and therefore blood flow to be greater at the base than at the top of the lungs. Just as the gravity produces regional differences is the alveolar inflation. See ventilation in the imbalance in the lungs uneven is also produces regional differences in the blood flow. Blood shifts between the pulmonary and systemic circulation system as a result of the cardiac pathology. In the heart failure, mitral stenosis or mitral regurgitations causes blood to dam up in the pulmonary circulation, greatly increasing pulmonary vascular pressures and volumes, because the volume of the systemic circulation is about 9 times that of the pulmonary system. A shift of the blood from the one system to others affects the pulmonary system greatly, but usually has only mild effect on the systemic circulation. Blood flow through the lungs and its distribution is very important in the circulation, lung circulation. Pulmonary blood flow is nearly equal to the cardiac output, okay, is the equal. And in the figure you can see the cardiac is equal with the total tissue blood flow, and you can see the right heart blood enter the lungs, and from the lungs enter the left heart. Okay, and this shows the cardiac output is equal to venous return of the sum of the tissue and organ blood flows. In this figure you can see effect of increased cardiac output to pulmonary blood flow and the pulmonary artery pressure during the heavy exercise. Okay, and you can see in this here cardiac output per liters in the per minutes, and effect of the main pulmonary arteries arterial pressure causes by the increasing the cardiac output during the exercise, and the normal value is this here in this here, and shows the pulmonary arterial pressure is normal. Okay, after that change the cardiac output, the pulmonary arterial pressure is not changed. But in the cardiac output will be high, and this causes the pulmonary artery increase. The ability of the lungs to accommodate it greatly increases blood flow during the exercise without increasing the pulmonary arterial pressure. Conserves the energy of the right side of the heart, and this ability also prevents a significant rise in the pulmonary capillary pressure, and thus also preventing the development of the pulmonary edema. The left atrial pressure in the healthy person almost never rises above plus 6 millimeter mercury, even during the most strenuous exercise. This small change in the left arterial pressure have virtually no effect on pulmonary circulation function, because this merely expanded the pulmonary venules and opens up more capillaries so that the blood